Most hernias can be treated by your primary care physician with elective, watchful waiting. They often don't need surgery and can be observed and referred only when they become symptomatic. Symptomatic hernias should be seen and addressed, though, by a qualified, experienced general surgeon. Symptoms of a hernia include pain and discomfort and can frequently be associated with nausea, vomiting, and symptoms of obstruction when a loop of bowel gets stuck in the hernia and prevents stuff from going through. The diagnosis of a hernia usually is made by the patient. They see the bulge in the abdominal wall and they realize quickly that there's something different about that area. The diagnosis of a hernia is actually fairly straightforward. When you go in to see the surgeon, they'll look at your abdominal wall and actually be able to get you to do certain maneuvers that will make the hernia stick out. Often they'll be able to feel the hernia or palpate it and push it back in when you do a Valsalva type maneuver. Sometimes X-ray will be used to diagnose a hernia. Not infrequently, an ultrasound will be obtained, which gives us a picture or an image of the tissue underneath the skin and can actually show the hole or defect of the hernia, as well as tissue protruding into the hernia sac. Another test that may be obtained is a CT scan of the abdomen. This is performed when the diagnosis of a hernia may be in question or when a patient presents to the emergency room with symptoms of pain, nausea, or vomiting. The CT allows us to see the defect as well as whatever type tissue may be in it, including bowel, which can be kinked, causing obstructive symptoms. Most hernias that are asymptomatic are treated conservatively, which means waitful watching. If they become painful or symptomatic, then they're referred to a surgeon for surgical management. Non-surgical management includes the use of truss or binders to help hold the tissue in and prevent it from bulging out, especially during strenuous activity or working out in the yard or something like that to prevent the hernia from bulging out. When a hernia becomes symptomatic, a primary care physician may refer the patient to the surgeon to have the hernia evaluated and see if they're a good candidate for surgical repair. Once a hernia becomes symptomatic, it is best to proceed with elective repair. And what that means is you choose when you want to have the hernia repaired, not the hernia. It's not the hernia that decides when you're going to have surgery. And that's very important. This is true especially in patients who travel a lot and may be out of town or out of the country and don't want to undergo surgery in an unfamiliar place. When a hernia becomes symptomatic, surgery is the treatment of choice to repair it. There are two types of hernia repairs. One is an open hernia repair, the other is laparoscopic. Open, as it sounds, is a 3 to 4 inch incision that's made over the hernia where the surgeon goes down through the tissue to find the hole, sew it shut, and possibly patch it with a piece of mesh to prevent it from coming back. This 3 to 4 inch incision takes time to heal and does have a longer recovery. Laparoscopic surgery involves using small incisions, a TV, and a monitor to go in under the hernia, usually into the abdominal cavity, find the hole, get tissue out of it that shouldn't be there, and then fix the hole, usually by patching it with mesh. Sometimes the tissue will be sewn back together, but often mesh will be used to bridge the defect and create what's called a tension-free repair. An open hernia repair can be done as an outpatient. It can be done under local anesthesia, general anesthesia, or even regional anesthesia. Open hernia repairs usually are a little more painful, recovery is a little bit longer, and there is a larger incision. With laparoscopic surgery, majority of patients have to go to sleep for these type of repairs. That requires a general anesthesia. The prognosis with hernia repair is very good. Most hernia repairs have a very low recurrence rate on the order of 2 to 3%. Hernias are usually repaired as an outpatient, and most patients are back to doing light-duty desk-type work within 2 weeks after their surgery. With an open hernia repair, your recovery may be a little bit longer, on the order of 4 to 6 weeks. With a laparoscopic hernia repair, most patients are back doing light-duty type work in 3 to 5 days and even driving within 3 to 5 days. The usual postoperative course requires a patient to refrain from any heavy lifting or strenuous activity for 2 weeks. At 2 weeks, most of our patients are lifting up to 20 pounds and back to light-duty type work. At 4 weeks, they're lifting up to 40 pounds, and at 6 weeks, they're back doing all their duties as they'd like to.